Let's talk about breast cancer, for
Absolutely.
example.
Yes.
Another very common thing. It's a very fearful cancer that people have.
Yes.
Or fear of that cancer.
Yes.
You know, my wife has a lump on her breast, and I'm concerned because it wasn't there, 2 menstrual cycles ago.
Right.
How do you approach that person?
Most patients who arrive to see me, usually they've had a mammogram or ultrasound performed at our Women's Center, where you can get all those studies done. And they found some abnormality, something different in their breast than the previous mammogram, or the patient has felt something different in her breast, or her husband has felt something different in her breast. And so once they arrive, we go over their ultrasound, their mammogram. I kind of explain the anatomy of the breast and how it functions, and then we decide how are we going to get a tissue sample to determine, is it cancer or is it not cancer?
Which is really the question that they have, correct?
Exactly.
And an ultrasound is a type of imaging study that doesn't stick any needles in you or
Exactly.
anything. It's a little ultrasonic transducer that puts sound waves through the tissue that you're looking at, and depending on how those sound waves bounce off of it,
Right. It'll show us.
it'll show a structure such as a mass.
Right.
Because we know what normal tissue looks like,
Right.
and therefore we can define abnormal tissues that are things that aren't where they're supposed to be.